Ever wondered who the superheroes are in the most critical moments of healthcare? Today, we're diving deep into the world of acute care nurses, the frontline heroes who manage complex, high-stakes patient situations. We'll cover everything from what it takes to become one, what they actually do, the skills you need to succeed, and yes, we'll talk about the salary you can expect. So, if you're considering a career that's both challenging and incredibly rewarding, or just curious about this vital role, you're in the right place. First things first, what exactly is an acute care nurse? Think of them as the specialists of the hospital world. They care for patients with severe, short-term illnesses or injuries. These are patients who need constant, intensive monitoring and treatment. We're talking about post-surgery recovery, severe infections, heart attacks, strokes, or major trauma. Unlike chronic care, which manages long-term conditions, acute care is all about the here and now, stabilizing patients and getting them through a crisis. So, how do you get on this high-stakes career path? It all starts with becoming a registered nurse or RN. This means you'll need to earn either an associate's degree in nursing, an ADN, or a Bachelor of Science in Nursing, a BSN. While you can become an RN with an ADN, more and more hospitals, especially for specialized roles like acute care, are looking for nurses with a BSN. A bachelor's degree gives you a broader education in leadership, research, and public health, which is super valuable in a complex hospital setting. Once you have your degree, the next crucial step is passing the NCLE XRN exam. This is the national licensing exam that every nursing graduate must pass to become a registered nurse. It's a comprehensive test that ensures you have the fundamental knowledge and critical thinking skills to practice safely. After you pass, you can apply for your RN license in your state. But the journey doesn't stop there. To really specialize in acute care, most nurses go on to get hands-on experience in a relevant setting. This usually means working in an intensive care unit, an ICU, a critical care unit, a CCU, or an emergency department. This is where you'll build the core skills needed for acute care. Learning how to handle ventilators, complex medication drips, and rapid changes in a patient's condition. Most experts recommend getting at least 1 to 2 years of this kind of experience. For those who want to reach the top of the field, the next step is often graduate school. You can become an acute care nurse practitioner or a CNP. This is an advanced practice registered nurse or APAN role. To do this, you'll need to earn a Master of Science in Nursing, an MSN, or a Doctor of Nursing Practice, a DNP. These programs focus on advanced assessment, pharmacology, and pathophysiology. As an ACNP, you can diagnose illnesses, order and interpret diagnostic tests, and even prescribe medications. You're taking on a much higher level of responsibility and autonomy. After graduating from an ACNP program, you'll need to pass another certification exam to get your ACNP credentials. Now, let's talk about the scope of practice. What does a day in the life of an acute care nurse look like? It's intense, fast-paced, and unpredictable. You are the one at the bedside, constantly assessing your patients. This includes monitoring vital signs, checking neurological status, managing pain, and interpreting data from sophisticated medical equipment. You're the first to notice if something is wrong and you need to act fast. You'll be administering complex medications, often through IVs. This requires meticulous attention to detail and a deep understanding of pharmacology. You'll also be performing a wide range of procedures, from wound care and dressing changes to inserting catheters and managing ventilators and other life support devices. Communication is a massive part of the job. You're not just caring for the patient, you're collaborating with a whole team of doctors, specialists, therapists, and other nurses. You're also the main point of contact for the patient's family. Explaining complex medical information in a way they can understand and providing emotional support during a stressful time. An ACNP's scope is even broader, often acting as a primary provider for their patients within the hospital setting. So, what kind of person thrives in this environment? What are the essential requirements? First, clinical skills are non-negotiable. You need to be sharp, knowledgeable, and proficient in your nursing practice. But the soft skills are just as important. Critical thinking is at the top of the list. You have to be able to analyze a situation quickly, connect the dots, and make sound decisions under pressure. Things can change in a second, and you need to be ready. You also need to be incredibly resilient and calm under pressure. Acute care is emotionally and physically demanding. You'll see things that are difficult and face high-stress situations daily. The ability to stay focused and composed is absolutely essential. Strong communication and teamwork skills are also a must. You are the hub of patient care, and effective collaboration with the entire healthcare team is key to good patient outcomes. Finally, you need a deep sense of empathy and compassion. You're caring for people at their most vulnerable, and being able to connect with them and their families on a human level makes all the difference. Alright, let's get to the part many of you have been waiting for, the salary. How much can you earn as an acute care nurse? The numbers can be quite impressive, but they vary a lot based on several factors. Let's break it down. For a staff RN working in an acute care setting like an ICU or other, salary is influenced by location, experience, and education. According to the U.S. Bureau of Labor Statistics, the median annual salary for registered nurses was around $86,000 in 2023. However, in acute care specialties, it's often higher due to the increased complexity and demand. Nurses in major metropolitan areas or in states like California, Hawaii, Oregon, and Massachusetts tend to earn the most, with average salaries often breaking the six-figure mark. For example, an experienced ICU nurse in a major city could earn anywhere from $90,000 to over $120,000 a year. Your level of experience also plays a huge role. A new graduate nurse starting in an acute care unit might begin in the $70,000 range, but with 5 to 10 years of experience, that can easily climb to over $100,000, especially with specialized certifications. Speaking of certifications, getting certified in your specialty, like a CCRN for critical care, can not only boost your skills but also your paycheck. Many hospitals offer a salary differential for certified nurses. Now, if you take the next step and become an acute care nurse practitioner, the earning potential jumps significantly. CNPs are in high demand and their advanced skills command a higher salary. The median salary for nurse practitioners in general is around $126,000 per year. For a CNP specifically, it's often even higher. It's not uncommon for experienced ACNPs to earn between $130,000 and $160,000 annually. Top earners in high-demand locations or those with extensive experience can even approach $200,000 a year or more. Remember, these figures are just the base salary. Many nurses and nurse practitioners increase their income through overtime, shift differentials for working nights or weekends, and on-call pay. Many hospitals also offer great benefits packages, including health insurance, retirement plans, and tuition reimbursement if you decide to go back to school for an advanced degree. So, while the work is demanding, the financial compensation can be very rewarding, reflecting the high level of skill and responsibility the role requires. In conclusion, a career as an acute care nurse is a journey of continuous learning and immense personal and professional growth. It starts with a solid foundation as an RN, builds through critical hands-on experience, and can lead to an advanced practice role as a highly skilled nurse practitioner. It requires a unique blend of sharp clinical skills, critical thinking, emotional resilience, and deep compassion. Yes, the days are long and the work is tough, but the impact you make on the lives of patients and their families is profound. You are there for people during their most critical moments, providing expert care and a calming presence. It's a calling as much as it is a career, and for the right person, there's nothing more fulfilling. Thank you so much for watching. If you found this video helpful, please give it a thumbs up and subscribe to the channel for more deep dives into healthcare careers. If you have any questions or are an acute care nurse yourself, share your experiences in the comments below. We'd love to hear from you. See you in the next video.